we didn't talk too much about reverse T3. It's a controversial factor. It's considered experimental. I do run it on most of my patients. 8 to 25 is the average reference range, nanograms per deciliter. The argument for reverse T3 is that under stress, you will make high reverse T3 and low T3. In a lot of cases, I see that when a patient doesn't when a patient does not convert well to T3 from T4, they often enough, but not always, show a high or higher normal reverse T3 and a low free T3. So when do I get concerned? I get really concerned if I have a low free T3 and a high reverse T3. If I'm low in the range, low normal free T3 and high normal reverse T3, I get the picture that the patient is under stress. Now, let me just say this. It is normal for a patient with another disease to make less T3. So when people come to me or they read on the internet, I'm making low T3, I have inflammatory bowel disease, I'm not responding to therapy, I'm 10 pounds underweight. That's what happens. So sometimes I give some T3. I would not recommend to doctors. I saw there were some doctors online that you just give T3 when they're low in T3 blindly. There are cases where a patient is suffering from other inflammatory problems and are making low free T3. We're giving little bits of T3, helps them symptomatically, helps the bowels. So my alarm, when I see the actual high reverse T3 and the actual low T3, I know that what they wrote these studies about is actually happening.
How often is heredity involved in the thyroid problem?
Oh, I would say 70 to 80% of the time. Most thyroid disease is autoimmune, and autoimmune thyroid disease is very often hereditary.
Have you ever, in your practice, seen acupuncture really help with thyroid?
Yes. Acupuncture is a system of medicine that does treat the entire body subphysiologically based on a system of rivers and valleys that were not developed in the age of medicine. But we do see help there often.